Understanding the difference between dietitians, why it matters. It's important to know which dietitian to talk to, especially if you have heart issues or kidney issues, and most importantly, if you're on dialysis. A dietitian is a food and nutrition expert, but not all dietitians are the same. A registered dietitian, or RD, may work in general wellness, weight management, or sports nutrition. Specialized dietitians focus on specific conditions. A heart dietitian helps manage cardiovascular health. A renal dietitian supports people with kidney disease. A pediatric dietitian works with infants and children. A sports dietitian helps athletes optimize performance. When chronic conditions overlap, knowing which dietitian to consult is critical. For example, a heart dietitian may recommend foods that lower blood pressure and cholesterol. These include leafy greens, berries, citrus fruits, tomatoes, avocados, and whole grains. These foods are high in fiber, antioxidants, and potassium. They help reduce inflammation, improve blood vessel function, and support heart health. But many of these same foods can be harmful for people with kidney disease. Why? Because they contain high levels of potassium, phosphorus, or oxalates. In kidney disease, the body struggles to filter these substances. High potassium can lead to dangerous heart rhythms. High phosphorus can weaken bones and damage blood vessels. Oxalates can increase the risk of kidney stones. For example, spinach is rich in potassium and oxalates. Avocados and bananas are very high in potassium. Tomatoes and tomato products are also high in potassium. Dried beans and lentils contain both potassium and phosphorus. Grapefruit can interact with medications used for diabetes and heart disease. Orange juice is often praised for heart health, but it's high in potassium and sugar. Risky for kidneys. Superfoods like moringa and jute leaves are nutrient-dense and heart-friendly, but they're also high in potassium and phosphorus. Papaya, mango, and soursop are tropical fruits that support heart health, yet pose risks for kidney patients. Cultural foods matter. Patients should ask, are there high potassium fruits or vegetables in my traditional diet? Asian and tropical diets often include exotic fruits and greens that may be unsafe for kidney disease. Nutrition guidance must be specific to the condition. What helps one organ may harm another. If a patient has heart issues but develops kidney disease or kidney failure, the renal dietitian becomes the primary guide for nutrition. Doctors receive limited nutrition training. Pharmacists may not routinely warn about food-drug interactions. That's why patients need to be proactive. Ask, is this food safe for my condition? Should I speak to a renal dietitian or a heart dietitian? Are there cultural foods I should avoid or modify? By consulting with a specialist, patients receive tailored guidance that addresses their specific, interwoven health needs, which ultimately leads to a better quality of life and improved long-term outcomes. They teach the patient how to read food labels, navigate social situations, and incorporate cultural food preferences while staying within dietary guidelines. If you or someone you know has heart or kidney issues or both, encourage them to speak to a specialized dietitian. Let thy food be your medicine. But remember, not all food is healthy if you're dealing with complex health issues.